Aspen Medical is a global provider of innovative healthcare solutions. Our clients come from the defence, government, mining, oil and gas, and humanitarian sectors. We are a world leader in the delivery of healthcare solutions in any setting, particularly those that are remote, challenging, or under-resourced. From humble beginnings, we have become a highly respected and award-winning business with over 2,000 team members serving clients across 400 sites in Australia. We also have operations across the Pacific, Africa, the Gulf region, the UK, and the USA. Our clients partner with us because we have a track record of getting things done. We are committed to quality and excellence. Our comprehensive credentialing process ensures that we only employ experienced and highly qualified health professionals. Every day, that team provides a range of services to our clients, including primary healthcare, emergency healthcare, aeromedical evacuations, environmental and public health services, occupational health, consultancy and training. We offer a flexible service from a single paramedic to a full team of healthcare professionals, ambulances, medical facilities, equipment, consumables, pharmacy products and our own aviation assets. These services are provided by various companies from across our group. We reduce surgical and dental waiting lists, re-establish hospital departments, conduct millions of appointments every year. We've helped stop Ebola in its tracks. We've provided daily healthcare to 80,000 defence personnel at bases across Australia, conducted more than 1,000 life-saving aeromedical evacuations globally, managed trauma and maternity hospitals in conflict zones in Iraq, provide battlefield first aid training to 60,000 defence personnel and civilians. We look after the health of thousands of workers in the resources sector. We provide health professionals to remote and rural locations in support of government programs. We've managed ambulance services in the Gulf region and in the USA, deploying state-of-the-art mobile health and surgical units to maintain services at hospitals, conduct hundreds of pre-employment medicals every week, deliver thousands of vaccinations, and we've saved a president's life. But there's more to us than being a globally successful business. We are a company with a genuine sense of responsibility to those around us, and we are proud to be a member of the B Corp community. A percentage of our profit goes to the Aspen Foundation, set up by the founders and owners to undertake life-changing healthcare by significantly reducing or eradicating disease in Australian communities. Our workplace giving and matching program ensures our team can support what is important to them. Aspen Medical. Innovative healthcare solutions. Guaranteed outcomes.
Good morning, Dr. Hashmi. How are you?
I'm good. How are you doing?
Very, very well. Looks like there's been quite a roll-up today.
Yes, it has been. It's been some really interesting discussions.
Yes, yeah, and some great questions. I think there's still so much to learn as well, but so many great perspectives to have learnt from so far.
Absolutely.
Are we ready to start now, Dr. Hashmi? Are you?
I believe so. I think we're on time. We're ready to start.
Perfect. Well, I'm very, very interested. You're at NEOM, which is just such an amazing initiative on behalf of your country. And I wondered what you've been working on in terms of the NEOM strategy for embedding technology into the health, wellbeing and biotech ecosystem that exists there.
Sure, I'd be happy to share that with you. So first of all, it was really nice connecting a couple of days ago and today, and some really nice people to connect to moving forward as well. And what's interesting about NEOM is a destination, so it's developing into a country within a country. And what I'm looking into, or what I'm leading from my end, is the health and well-being biotech strategy in the sector as a whole. And what's interesting about it is that there's so many learnings that I have picked up from institutes like yours and the others of many of the speakers that we're talking to today. And what we're building is not really a health care system, but a health caring system. So when we talk about healthcare systems, many times people focus on immediately sick care. And we've sort of shifted that, and we've started investing in healthy people. So it's really from cradle to grave. And what we're doing now is trying to formulate a way of living where we invest in healthy people and invest in care right from the beginning. So it's quite person-centric. And to give you a day in NEOM, just to give you a sort of a glimpse of the technology there, is that when you wake up in the morning in your home in NEOM, if you were in NEOM at the moment, and when we build this, is that you will have a city that's designed as a gym. So at the moment, the way the country we live in is not as walkable as we'd like for it to be. And there's a huge shift where walkability, and we talked about that earlier today, is that will be of essence in terms of our health and how what we do, just aside from diseases, how do we take care of ourselves? So you have, for example, Singapore, where you have 700 kilometers of cycling routes for everyone. And it's naturally a walkable city. So we will be designing a city that's healthy by design. It's a city that's designed as a gym. But and in itself, the housing itself will be smart devices within the homes to nudge you for healthy habits. So you'll have a toothbrush that will remind you about getting your dental checkup done. Or if you haven't done 2 minutes, more than 3 minutes, it'll remind you you've done only a minute, you need to keep going. So technology embedded within your homes to remind you of healthy habits, to continue to have a continuum of care where there's no fragmentation between the home to the hospital, and there's no distinguishing between that. So moving away from the hospital, but developing technology and care that starts from homes and takes you all the way to the hospitals when needed. It's the wise mirror, you know, looking at your diagnostics vitals, letting you know if you're okay, if you do need to get checked, then having an AI digitally enabled Dr. NEOM from the comfort of your pocket, reminding you of your checkup, if you're going to eat a cookie and you have a wedding the next day, you know, are you going to fit in those tucks? You know, so we're looking into personalized health and technology at a very different level where it's embedded within your lifestyle. So it's not as, I wouldn't call it, we're trying to humanize technology. And that's like how I'd like to put it, is where people become adaptable to technology. It's agility, accessibility, adaptability all together, where it becomes part of your life that you don't give it a second thought, but you have enough nudging to keep you healthy, to prevent you from being sick. And if the time does come, we have, you know, personalized care that's your needs to your genotypic, phenotypic data, so that we do have the means to have a cure when the time comes. So the whole strategy is based on breaking the silos. And what's interesting is COVID actually expedited that, to say the least.
So can you give us an example of how COVID was able to expedite it? Because I'm sure everybody listening is fascinated by the idea of a completely ubiquitous and integrated healthcare system that's helping you walk to work, advising you about your teeth. You know, the mirror is telling you whether you've got the right pallor and color. How did COVID accelerate that for you in NEOM?
So just for example, we've been talking about telehealth, you know, virtual care. And this was something that we said in 2 years' time, we'll be able to completely embed within the society, where the destination we are to all the people. And we were talking about steps we'll take. When COVID happened and everyone went into isolation, immediately we had an emotional virtual care set up for the team. We had mental health care services set up virtually. We had telemedicine services, consultations, everything became virtual. And it became a necessity for people to be able to connect to the consultants and doctors that they needed to through this virtual care. Even those that weren't really adapting to this, and I thought it will take them time, immediately adapted to it. Even technology like Microsoft Teams, Zoom, and the like, yes, we definitely always need the human component, but we were socially distant but emotionally together throughout the 6 months that we were there. And technology played a huge role in that, is that it was immediately connecting us, letting us have less fear about being alone. And what's interesting is one of the studies we did is that many younger populations and younger people feel more alone during the COVID pandemic, felt more alone than older populations. And it's because they're not used to this disconnectedness or being at home more so. than the elderly or the adults. And what it did was this type of technology where you bring in virtual care, you bring in emotional support services, where you're able to access a life coach immediately to you talk about your concerns, really help cater to that. And having a team set up, Zoom set up, WebEx, to immediately connect to them on an ongoing basis, that you're not alone in this, we're all in it together, really, really accelerated the thinking. And not only the thinking, but one of the main components of our strategy is breaking silos. Is not having a fragmented system, it's having a completely end-to-end streamlined integrated system where public health, private health, mental health are all integrated together. Mental health is not an external component of healthcare per se. It's a very important part of healthcare. So there's emotional well-being, there's physical well-being, there's there's all these elements that we were thinking of, talking about and putting into action, but everything was accelerated through the advent of this pandemic. And what it showcases is that when the time of need comes, you need to do something to immediately adapt to the change. And if you have that access through technology, it helps expedite it. And I would like to say the same question to you, actually, because it's just curious about Aspen. Your whole strategy is based on so much around technology. And did COVID have an impact on that as well?
Yeah, thank you. We'd had already started doing a lot of planning around technology last year. We do a lot of remote site work. Actually, one of our very early projects 15 years ago, we actually did telesurgery into a Pacific nation with someone who had quite a serious head injury, and that was well before there was the ability with good internet and some of the Da Vinci robots. So we had a surgeon advising one of our surgeons doing some cranial surgery. It was really, at that time, quite unusual. So we've always tried to be at the forefront of engaging. But I think what you spoke about, Dr. Hashmi, was what we had seen, which is there wasn't a problem from the clinicians. The problem for acceptance of technology and telehealth really came from the patient side. And I think, in these last 8 or 9 months, we've seen almost a decade's worth of movement of patients who are now so much more willing to have a consult, to have an appointment, to receive guidance. And I think that's really critical. Whereas people before would get in a car, drive down, go to see a doctor to get a referral for a specialist, they now just pick up the phone while they're making a cup of coffee. They get the referral, 5 minutes later, it's all done. And it's better for everybody. It saves so much time. But we've also found that one of the things we had to develop was using areas where internet access could be quite poor and patchy. And so our systems had to be very robust. So where we work in a capital city, no problems with the internet. But for those of you who know Australia, a very large country, very sparsely populated, a lot of very, very disparate little groups. And so being able to get internet access there required a very robust system so that you could get with the very lowest of bandwidth and yet still be able to do the consult. So those things were really critical. And we were able to step up the pace of those when COVID hit very, very quickly, particularly also, just to add on, when there were when you couldn't travel across borders. And so we would have typically moved people. Now we weren't even allowed to move them within Australia. They were stuck within states. So the teleconsult role really just accelerated manyfold.
Absolutely. Just to that point, we hired people during the COVID period when there was a lot of other companies and that were on hold, and we kept going because we said we have to keep moving, and all the hiring, everything, the onboarding and the work was done online. It was done remotely, and it was amazing to see that. I had not met my own, one of my associates. I got to meet my associate just a couple of weeks ago. We've been connecting for the past 6 months, but she's been working with me and it's been amazing. And what technology has done is that it's connected us much more. and much more rapidly than we ever thought it possibly could. And we thought that things would slow down, but in an attempt to be at the pace of the way this was going and the way the isolation periods were and the remote lockdowns were, and it was causing a lot of lockdown fatigue, is we had programs set in where you would have a life coach and your doctor to see you at the same time. So maybe it's really you might be just feeling some physical symptoms just because of your emotional health rather than your physical health. So you see them together in a call, and it just makes it that much more productive. And I'm sure you must have experienced that too. Did you see mental health change during the COVID period?
Absolutely.
The support system, yeah.
Yeah, absolutely. One of the things, and I'd be very interested to hear how yourself found it, but we actually found that we noticed difference between genders. So particularly men were very, very comfortable with telehealth for mental health. I think it gave them a concept of distance, and so they felt more comfortable opening up and talking about issues. There's been quite a bit of research done, and we saw this very, very clearly for our people working remotely, that the men actually had as good, if not even better, results using telehealth for mental health support. It was really, really critical. But the interesting bit too was that their consults were slightly longer, whereas it took time for them to build to their issues and get an understanding. Whereas we found when we were dealing with women, they were very clear what their issues were. They were able to get to the nub. And I think men often struggle, particularly nowadays, to talk around mental health issues, particularly during COVID, where they perhaps felt they needed to be stronger, but they really needed lots of support.
That's a very interesting observation. We had a very huge, in terms of just mental health support services, we didn't think that so many people would be receptive to it, but we had a very, very huge turnaround, and we were very excited about that everyone was really responding to what was going on and trying to make it better through themselves and through others and through this connectedness. So technology played an instrumental role in getting everyone to be at pace and to maintain and sort of take this ride together as we experience these past 6 months. And as we move forward, a lot of the strategy that we were thinking would happen in 3 years from now, we're actually implementing next year. And just in terms of design thinking as well, it's having a lot of space for being sort of future-proof, but also pandemic-proof. You're going to have these outbursts, throughout this time, and we don't know when they will come and when they won't. But designing our buildings, designing our models, designing our cities in a way that we're able to immediately, effectively, counter these situations. And technology plays a huge role in that. We also are working on genetics and genomics sequencing, and at the moment, that is all around precision health. And I talked about this earlier today. I wasn't sure if you were on, one of the participants at that time, but we are developing a platform, and that's going to be launched. Initially, was supposed to be launched, was going to launch next year, but I'm about to launch it. Is going to be a platform where we have a program set in. It's a virtual care program, but it's really you connecting you to nutritionists online. And you talk about your health habits, and we've seen the vulnerable, a lot of people with chronic diseases were much more at a vulnerable, place during this pandemic than others. And what do you do? How do you help them? And what this program will do is that they will be looking into your eating habits and seeing how we can develop it into a healthy, personalized program, so that you're able to cater to your, your needs of eating what you like, but in a way that is healthy as well, and controlling your sort of urges in a healthy way, and personalizing it across your journey of care. And so it becomes a person-centric journey. It's a family-centric journey. The families were as much affected through COVID as others. There were many people, even here, that were disconnected from their families. So there were programs that were set in to help them through virtual care and through emotional health programs online to help the family members cope with the distance that they were experiencing during this time.
I'm very interested in the NEOM model, and you spoke about wellness and nutrition. So you're pulling many different threads together. So as part of what NEOM's doing, is it creating like a digital twin of every one of its citizens so that they have an understanding of their conditions and comorbidities and engagement with health and fitness? Is that sort of the
Yes.
model you're following?
Yes, yes. So just in terms of design thinking, NEOM will be a society where you opt into such things. For example, we were talking earlier today about data privacy and people being receptive to secondary use of data. And many people are not used to that or are sort of a bit concerned about that. But the type of society we're developing is that it sort of pulls in people who are interested in getting to know more about it, who opt in. It's an opt-in choice. You know, it's something you opt into when you come there. And you take your genotypic and phenotypic data, and you will have digital twins that will be personalized to you and will cater to your complete makeup. And then that will be the precision medicine that we'll be offering, is that for each person, there'll be a digital twin, and you'll be able to monitor your health yourself. So it's empowering you as an individual, empowering the system by having healthy individuals that doesn't sort of drag the system with a lot of expenses, because you invest in healthy people, so you have healthy outcomes. But at the same time, it's also knowing about your health right all the time in a way that you want to know about it. So it gives you the independency, the empowerment, and also the knowledge for you to be able to take action when needed on your own, without even having to have someone tell you from your family or your doctor to having to contact you, because you will be aware that something is right or something is wrong and need to take care of it.
It's a fascinating period, I think, taking digital twins to particularly if you can then start to build that very, very robust data set that will allow you to use AI to predict what some of those issues might be. And then, if you like, retrofit the preventative health measures that you're going to need to put in place.
Absolutely, exactly. And I think it's interesting that now that we have accelerated our progress, this will be coming sooner than expected, just because in terms of precision health, we were talking about social determinants of health and how they impact you as well as a person in your health. And one of the interesting also models of care that we have is when you give this virtual care, you don't see your doctor per se only. You see a group of doctors. You have a nutritionist, you have a life coach, you have a psychologist, and you have a general practitioner. So we're also evolving the roles that you see in the medical space, where you have more of an option to see what level of care do you really need. Do you just maybe need to see a nutritionist, or you have that already in the US? The concept of a registered nurse is not common in Saudi Arabia. So you usually do see a family medicine doctor, as they call it. And one of the elements of changing or evolving the roles of individuals is when you have a registered nurse who can prescribe medicine and can see you as a GP, it helps sort of make the system more efficient. With the type of, at the moment you have a shortage of a lot of doctors and nurses. How do you make it more efficient worldwide, and how do you make it a example for others? So we're sort of having a model of care where you get to see a group together, and that group can determine if you really need care beyond that, or through your digital twin and through the nudging devices and through Dr. NEOM, is that sufficient to take care of you? And that's really what we're looking into. And COVID has sort of made us even more aware of some of the other elements we'll need to see as we move forward. Food, was mentioned this morning. That will have a huge role in preventing chronic diseases. And how do we make people less vulnerable to such types of pandemics and such types of diseases, is that we make them so healthy and prevent this. Their diabetes and obesity is a very prevalent problem in this region. And that is something we're trying to cater to. And this pandemic has just made it that much more important to cater to that. So personalized medicine, personalized care, and technology that nudges you on an ongoing basis is that much more important in taking care of you.
We had an interesting example when you're talking about the personalised care, talking about it at a slightly larger level. We were contracted by the Australian government to roll out what they called respiratory clinics. So they didn't want to get people who had COVID coming into the primary care practice for fear of infecting the whole practice. So our job was to survey and build respiratory clinics that were connected to but not inside of the normal primary care clinics. And we rolled out 150 of those across the country, the first 122 in 5 weeks' time. And initially they just were after buildings. They wanted buildings, yes, they wanted computers. And we said, look, there's going to be a lot of very rich data that we can get here, that we can feed back to you. So we actually developed all of the applications and programs and databases for the Australian government that were used as part of their data capture for COVID. Now, I'm sure we'd all realise normally to do that would be months and months. We developed 9 separate applications and platforms in 7 weeks, rolled them out and had them operational in the field. One of the critical elements, though, to your point around data, was that we would capture the data every day, come and bring it back to a common system where it was being checked by AI to look for symptoms initially of COVID, but then we started to look for other symptoms so that we could develop hotspots by suburbs, even down to streets, where we could say, right, there seems to be something happening in this street every day. We were able to look at that data, and that allowed then the public health system to move around and go, we think there's a problem in this part of the suburb or even in this street. They could door knock, they could then do testing and really bring down the transmission rate. So I think it's interesting because you've taken personalised data, a digital twin, to a new level. And normally you have health data way out here, but we were able, I think, to bring the pair of them together to have it down to a suburb or street or even a part of a street, a number of houses. And I think how we cut and dice that data going forward is going to be really critical. But that adaptability, the ability to be able to develop a program in just a matter of weeks, have it tested by, for victim analysis through cyber alert, and then have it rolled out is something no one had ever done for the government before. But I think we're all going to have to be more adaptable like that. I'd be interested to hear what you had to do very quickly to adapt things that you'd said you had a long program to make it happen very quickly.
So just as, like I mentioned, one of the things we did do is that many companies and many entities had to close down. And what we did was that we continued our remote working immediately. We adapted to working remotely and virtually, which is not a norm at all here, to say the least. But not only did we do that, hiring was continued, and everything around our, at the moment we just have a community center for a health center. We don't really call them hospitals. It's a hub and spoke model. Our hospital will be built, but at the moment it's a health center. It's a small health center. And also that was it was telehealth. It was, it was virtual care, immediate access to all the doctors, psychologists, emotional support, whatever you needed. So we immediately adapted to working in an environment where you don't really need buildings anymore. You need yourself. And you need people to just connect to through some device where you continue working. And that in itself is a change in the mindset. And I always get excited about this. It's a change in the way we think. It's a complete shift in the design, the way we think, designs and systems, designs of cities. Do we really need buildings in the end of the day? What will we need in the future to make us survive? What are the main crucial elements? Because when you see how we adapted to this type of crisis, what will we need in the future to adapt to more? How agile can we be, and how quickly can we adapt? And technology is absolutely one of the answers. And technology with human support, there's always a human at the end of technology. And when I talk about technology, people talk about, are humans an important role? We will have virtual care. We will have surgeries where we'll have doctors at the end, in the US performing surgeries with, for patients in Saudi, but the human component will always be there. We will always maintain that human component. And even right now, this human component of us being able to connect to one another through this platform, which this platform was initially supposed to be in person, is still happening, right? And this is amazing, and technology is playing a huge role in that. So we can't overlook that, but it's just something we think about is now, how do we change the system? Will we really need a hospital, or will we need these types of technological devices in different buildings where we're connected to one another? And will that be sufficient? Will we have drones taking us from our homes to? We have a lot of mountains here, so I'm in the middle of mountains, a desert, and the sea all at once. So it's quite a beautiful sight. So I'm in literally in the middle of one side. The left side is mountains, the right side is the sea, and I'm in a desert. And in that, do I need a lot of buildings, or do I need the type of technology to maintain the progress of what we're building together? And these questions were sort of realized sooner than expected because of this sudden pandemic, and it sort of accelerated the progress of how soon should we make things happen, and can they be doable? It was a pilot study in the past 6 months, because we were having people join us online and they work with us, and I finally got to see some of them recently, was in itself an example of how amazing technology proved to be during this time.
I think you raise a really, really fascinating point about the change of facilities and the change of design. In Canberra, the capital city of Australia where I live, there was a real concern that if we saw the volume coming of people with COVID that needed to be ventilated, that we would just completely run out of space. And what they didn't want to do was have people with COVID coming into the emergency department or the emergency room and infecting everywhere else. So we were contracted to design and build a very specific emergency room just for people with suspected or confirmed COVID. And they, from the time we stood on the bit of grass where it was going to be to the time it was fully built was 4 weeks. And it's the very latest in design. We use WHO, CDC design, and it's got red, amber, and green zones. But the number of people we've shown through, because we're really bringing a whole pile of new thinking around operational context. But now people are saying we've got a major hospital's going to be built here, and people are saying for ICUs, do we need to have a staging area first where people would go in, maybe they'll be confirmed, do they have COVID or something else before they're put into the ICU, because we don't want to run the risk of contamination. So do we have a staged capability within there? And I think there's going to be a lot more thinking about, as you say, can we go for a much more dispersed model? Yes. Do we need to be able to have levels of confinement and isolation so that we don't run the risk of contaminating and then losing access to facility? Even in regards to tracking, we had a facility in Melbourne where they believed they had a close contact, so they sent everybody home. 680 staff all had to go. So suddenly they were trying to refill the entire population of staff. Whereas if there'd been a technology tracking solution, which we use in our facilities, they could have identified there were 45 people who were close contacts. Everyone else can come to work, you all go home. So I think this is going to radically change how we think about some of these facilities. I should say to people, if you've got a question, please shoot them through to the Q&A section. I'm sure that Dr. Hashmi and myself are very happy to take any questions if you were interested in asking, because I think NEOM is going to be exciting. It is going to be such a template for the rest of the world, not just of how facilities work, but how a city is integrated. I was fascinated to hear you open with the idea of saying that it'll be a city as a gym. Just as long as I'm not on a cross trainer in the one spot the whole time, I need to be able to move from one to the next.
I would be, yes, I would love to have some questions. I think this is more of a chat than a discussion, and it's really about our learnings from what we've experienced for technology and a different shift of thinking.
Absolutely. So is there anyone who has a question there for perhaps for Dr. Hashmi or myself? We'd be very, very happy to take a question. I think they're all in awe of what you're doing in NEOM there. Dr. Hashmi. They don't quite know what to ask because maybe they're a little afraid. Maybe I will just lead with one question while people are thinking about it. If you had to pick one thing that was really critical that you learnt during this COVID period that you want to take into perhaps changing how the NEOM healthcare would look, what would be that one thing that you would say, we hadn't thought about that, but now we will do that differently?
That's a very good question. It's not agility, it's adaptability. And there's a difference between the two. You know, one of the things that sometimes you never think about is when we were factoring in our strategy, we were talking about everything, but there was this whole element of having a pandemic where you go into a situation like this was not discussed. And it was amazing how immediately we were able to come up with solutions of how we will cater to that in the upcoming, you know, days and years to come. And it was a really interesting learning for us to see what we did even through this 6-month period. I'm the deputy chair of the COVID task force at NEOM. And we had this emergency task force set up immediately of what are some of the immediate actions to take. And the first thing that everyone pointed to was mental health support. We knew it was going to be a very, very stressful time, and that everyone will need that. And there will be people, expats will be working here, will be away from families. So how can we set that up immediately so that they feel assured that they will be able to go home when the time comes and when there's an opening, but at the same time that there's emotional care available for them immediately. So and now the mantra is adaptability, agility, and also just learning to have a new way of thinking, generally speaking, in everything. And that's really been a really interesting learning for us. And as we continue this model of, you know, building what we are open to is ideas. Because we have such a flexibility and being future-proof is the way to go. Even now, as we have new learnings, the way we've set up our strategy and implementation plan is we'll be able to immediately adjust it now than we thought we could prior to this 6 months ago.
One of the other things, and thank you, that's really, really interesting. And I agree with you, it's more than just agility. So it's about thinking about how to bring other areas that were perhaps completely different to bear on a problem. There's a number of people who are really interested to hear a little bit more about the nexus of food, nutrition, and healthcare. And so they're wondering if you might expand on that a little more, please.
Sure. I'm talking from the biotech and health side, but we do have a food sector as well. So we will be organizing a sort of a merge between the two, where we'll have personalized organic food. That will be also a separate part of our strategy. But what we are looking into specifically is looking into how to prevent chronic diseases or how to manage them when you have them through different health programs. And initially, the idea was to have the health programs in place physically, but now the idea is to have a health platform that sort of takes note of you. So I'll give you an example of a Fitbit. I was not a Fitbit person, and now I wear it, everywhere, and it just gives me track of my 10,000 steps. Otherwise, with this type of remote working, I would not be, aside from the gym, I still need to walk. And so the health platform is to just remind you of some health habits and sort of take note of what you eat, and it tracks the data. And what it does is that it's able to give you a personalized food program that might help, looking into your allergies, looking into your current weight, with a nutritionist virtually available. We'll be looking into your history of, if you have any past medical history, and then putting all of that information together to come up with a personalized program that helps your stress and that helps your eating habits in a way that you're not dieting per se, but you're able to cater to eating food that might still be really delicious for you, but the quantity might be decreased. They might remind you that, just decrease the amount of rice you had today. So it monitors you and nudges you to take care of yourself on an ongoing basis. Now, this is from the health side. From the food perspective, there is another sector that's working on actually developing organic food through specific farming that we're having here, and that food will be completely personalized to individuals. And that is another element we will be bringing into NEOM, is that you'll have personalized food catered to your needs, but these programs will be personalizing your program in terms of what you eat, when you eat, how you should eat it, and sort of give you, they're a mode of nudging devices. It's taking Fitbit to another level, to a level where you're being nudged on what you eat in a friendly manner. All of us have smart fridges that remind us of the calories we take. So it's just the typical, these are little nudging elements that actually really design its behavioral change. In the end, that is important. And technology can be instrumental in behavioral change. It can help, you track yourself, but at the same time, over a period of time, change your behavior. And that is the sort of gist of the whole project, is how do we change your behavior from eating a lot to maybe eating less or moderately, or changing the way of what you eat and how you eat it. And that program will be facilitating that.
Yeah, I think that's really fascinating. We do a lot of remote area work in smaller sites for be it resource sector, oil and gas sites. And with lockdown, a lot of those people that would normally be fly in, fly out had to stay there. So normally they might have been there for 2 or 3 weeks and they'd go home to their families. Now they were there for 4 or 5 months. And so what we had to do, and it was interesting, I just tweaked when you said nutrition, we did a range of work because, to be honest, their food was about making them happy, not making them healthy. So we looked through the food, identified, really simple things. So they were nudged towards vegetables, nudged towards salads. They were all first. Small things. We made the plate sizes smaller.
Yes.
So that people didn't load up so much. And then we just did really simple things like portion control. So by the time they got to the stuff that perhaps was the heavier, the meats or the fats, they'd already loaded up vegetables and salads on a small plate. And it was very interesting because everybody said the productivity went up and the lost time injuries goes down. No one had expected to do that during COVID, but we'd had to do it because we were now also buying locally because we were not able to ship in food from around the country. We were having to buy from local producers to use that food as well. So real benefits that there. It's interesting. The companies are not going to go back. They're going to stay with the lessons we've taught them now.
Absolutely, absolutely. And I think just in this talk, it's nice how we're talking about food when we talk about COVID and healthcare. That in itself showcases just the different stance of how prevention is such an important part of the health and well-being ecosystem, and how preventative care includes things like taking care of what you eat, which people have become more aware of now than before.
Yeah, I agree. One of the things I understand NEOM will have a quite an impressive cancer facility in support of cancer research and delivery. Are you across much of that? Because there's been a couple of questions. People are very interested in that element.
So our strategy is really specifically focusing on 3 main areas. It's diabetes reversal, it's musculoskeletal diseases, and personalized health and personalized health care. Cancer will be sort of in the personalized care more so than the treatments. It's about how to prevent it than how to have solutions for it or cures or the likes. We're really focusing on the preventative part of that. And what at the moment we have a sort of a model set up where it's a hub and spoke model, but at the same time, aside from the hospital itself, we have centers of excellence. And we have another element that's very interesting is the medical wellness resorts. And the medical wellness resorts, again, adds another element to health and well-being system is holidays. And how do you become a part of how does your holiday become a part of your healthcare? And how does it cater to your family, to your needs? So we'll have a diabetes reversal medical wellness resort. So it will be a spa-like getaway where you have the hospitality angle to it, but we'll have also a very particular angle of medical care in it. So you will be able to be handling both your, any chronic condition that you might have in a holiday setting, where your family will also get training on how to manage what you have and have a holiday at the same time. So it's not creating separate siloed centers of care. It's creating a system where everything is connected. So our hospital, or we don't call it a hospital, we just call it a hub and spoke model. So one of our hubs for health will be connected to the wellness resort. So it's sort of an interconnected strategy where we are connecting holiday, so fun, from cradle to grave. It's a circular process. So right from birth to all the way around, we have something in place that caters to your health. We have a city that's designed as a gym. We have a hub and spoke model, where you have multiple types of, not just doctors, but nutritionists, life coaches taking care of you. At the same time, we have centers of excellence where we do have these digital twins that cater to personalized health, but they're all connected as well to resort-like settings, so that we have the medical wellness resorts type settings. So it also has a very fun and luxurious element to it. So it brings life and soul into the complete process. So it doesn't become like it's a different system where you have a hospital that's outside of you. It's all one. It's part of your person-centric journey. And all of these elements are part of your journey. Nothing is disconnected. Your holidays will be connected to you taking care of your diabetes, let alone not just you, but your whole family will know how to manage it, because we'll have fun programs within these resorts to let you know how to handle this and how to handle different types of conditions. So it's a complete interconnected, integrated strategy.
Sounds amazing. I'm so looking forward to visiting it. One other area that we've been involved in, and I'm really interested to hear you as well, is COVID, as you know, has been particularly deadly for the elderly, particularly those with comorbidities, and aged care facilities around the world have really struggled with COVID. There were some terrible stories in the first wave in Europe, where staff didn't turn up. Elderly residents in the aged care facilities were not cared for and passed away. There were some in some facilities where we're talking 60, 70, 80% of the residents contracted COVID and died. We've been called upon to do a huge amount of work. We provide clinical first responders into aged care facilities who go in. They do a complete survey of all of the infection prevention and control, all of the aspects, PPE, training, everything to help minimise the risk and transmission of COVID. I think at the moment we're in over 150 aged care facilities in Victoria alone, one of the states to the south of Australia. And I think we have about 65 staff in just one of those facilities. But it's meant that the numbers of deaths in those facilities have been very low. I'm very interested to hear from you around aged care in NEOM, because I'm sure that in the same way that everything else is so closely integrated, there'd be an integrated model for aged care as well, particularly probably home care and then finally transition. Do you think could you pass on a little bit about not only what the plans are, but what you might have learned during COVID about aged care support?
Sure. So at the moment, I will talk more about Saudi Arabia for the COVID crisis currently, because the NEOM population at the moment is between the age of 22 to 65. So we didn't have much of a situation internally per se. But what I think the country did really nicely, and I think it helped, was the proactive prevention element that was taken. And proactive prevention is so key to moving forward in these types of pandemic situations. I'll give you an example. Everyone in the country at the moment, and it goes back and forth, is everyone beyond the age of 55. There is a pilgrimage that happens here on a yearly basis, and they reduced the number from 3 million to only 1,000 or 2,000 people came. And and they were able to handle that because they had an age limit of who should go, and the elderly were given special attention to and care to. It was just about awareness. Everyone, in terms of flights, in terms of travel, in terms of announcements, they specified that if you're above the age of 65, they didn't even say 75, they said 65, try to stay at home, try to wear a mask, keep social distancing. It was more about awareness than anything else during this COVID period. And what it also helped us understand is how will we bring that into our NEOM strategy. NEOM strategy for home care is very interesting. So people think the elderly or older population is not receptive to technology. Well, there was a study that they did, and it's interesting. It was on Alzheimer's, and it was one of my friends, and they said they had a product in where they would, if they forgot any sort of key event in their life, they'd push a button and it'll remind them. And it just sort of made them aware of their what they should be thinking about or when next time, and remind them. And the population, it was in a home care setting, they were so receptive to that specific device that they asked for more devices. And so it was interesting to say that that home care will be a very essential part, and it will be part of the smart home setting that we will have in place, where family will be a very central role, will play a central role in terms of emotional way of belonging, the feeling to belong somewhere. We want to make sure that no one feels alone. Be it, you could be amongst 100 people and still be feeling alone. So how do you cater to that? And it's really about designing the way the cities are, designing the way the systems are, where everyone feels like they're catered to one way or other. And that's about the connectedness. Even for the elderly, home care is one, you have, but here in Saudi, it's really, people like to keep their parents with them. And that's, there is a culture of wanting to keep your older parents with you, because that's being more loving to them. That's the cultural thing. But at the same time, how can you make it easy for yourself and for them is you have the type of technology in place that caters to them. And it's we have a lot of in our strategy, robotic nurses that will have a human component to it. But on a day-to-day basis, there will be a robotic nurse that will be taking care of them. But you'll be able to come and see them. You'll be able to keep them in your homes. Your homes will be designed in a way that you can have a home where you feel like you're living with them or you're living without them. How you feel that day is because you have this type of device that sort of separates the home or connects it as needed. So it's really design thinking. It's the feeling of connectedness, and that can be through the elderly or the younger population. And just at the moment, the way the country handled the care in terms of proactive prevention was key in taking care of the elderly.
It's interesting you spoke about robotic engagement. There's been some fascinating studies done looking at all of the different types of careers that perhaps robots can do compared to what they can't do. And doctors sadly rate very highly in what robots can do. But one of the jobs they say that robots will be very, very poor at doing is nursing. Because as you right at the start of this talk spoke about, that personal connection, that ability to understand, to look at a person and assimilate, you look at the color of their skin, how they're feeling, the look on their face, how they react when you touch them, you go to move them or lift them. The robot can have the knowledge of a doctor, but not the emotional intelligence of a nurse. And I think that's going to be very, very interesting, and certainly having a tiered system between robotic support and an emotional support. I think that's going to be a fascinating interface as we move forward.
Absolutely, and that will be an interface that we are talking about. So emotional support is a key element of the strategy. Emotional support, emotional well-being, which is why we call it the health and well-being ecosystem. We don't call it a healthcare system, health and well-being. And even with the robotics in place, I always mention that a human component will be there. So it's about how do we manage resources. If we have a shortage of nurses, maybe we don't need them 7 days a week, maybe they come 3 days a week with an intermittent robotic nurse in place as needed. So it's the human component never disappears in this whole scheme of things, and it never will. Even now, we are humans connected to one another through technology, and everything would be still if we're not there. So that component will always be there.
One of the things that's we've seen not just in Australia, but we've seen in our offices in the US and in Europe, is that there's been a lot of people deciding maybe now's a good time to move out of a big city. Maybe we should move out into some of those smaller areas. And I can imagine there'd be a lot of people looking at NEOM going, that's the place I want to go. Maybe I should be moving out of this big capital city into this beautiful new city. How would you manage the flight of people wanting to come to NEOM and perhaps leaving some of those larger cities, starting to empty a little as they move to what sounds like an exciting place to live and grow old?
So this is a very interesting point. We were just talking about that earlier today, and it's about moving to more remote areas, so suburbs. Even in the U.S., I have family in Boston. My siblings are in Boston, and they're in the heart of the city, and they're looking into different suburbs around Boston to move to. It's a natural way for people to move during this time, but this will be actually when I talk about what are the positive outcomes of a crisis, it leads to traction. So we would like to welcome people to come here. At the moment, we're still in developmental phase, so we're not developed at the moment at all. But what happens is it increases the importance of places with more remote setting and more natural setting. And I think nature has a very huge role. I will never ever, neglect the sunshine ever again. If it's too sunny in Saudi, I don't complain anymore. I like it being sunny, I'll go out in the sun. And what happens is you realize the importance of nature and the role it plays, and these types of suburbs or these remote settings will be ideal in the days to come, but it will actually help us in terms of traction. And I think this COVID in itself has brought learnings that we never would have experienced ever before. So, there's an opportunity in every adversity. And I think one of the opportunities is to break the silos, develop an integrated healthcare, health and well-being, health caring system, and bring people together in a way we never thought to before, and bring technology to a level where it can be future-proof and it is able to adapt as things change.
Yeah, we try to use the term, I don't think we've been able to design a system that's future-proof, but we try to be future resilient. Yeah. So that who would have known that these things would have happened, but you can amend. As we sort of come up almost towards the end, I can't believe this has been almost an hour. It's been fascinating. But one of the areas that we are looking at, we have a lot of people who go on board ships that are often weeks away from shore, sailing down to Antarctica. We have people in very remote areas of Australia, and we're now starting to be engaged with our space program as well. And one of the areas of interest, I think, is augmentation. So being able to, how you might augment people, not to what we might see in science fiction films with cybernetics, but sensors that are perhaps just on skin, like a tattoo, or a range of others. I was wondering whether there's any thought, because with NEOM being so connected and having such a use of technology, have you thought around any augmentation of people that would be in a very pragmatic and practical sense now?
Thank you so much, Glenn. Before you answer, Maliha, please, I would like to remind you there are questions in the question and answers box. There are several of them. If you'll make sure to cover what you need before.
Sure. We'll look at them right now.
I've been through all of them, I think, sir. I don't think I've missed any yet. Sorry, after you, Doctor.
No, I think in terms of this, just generally speaking, that is an area of more sort of research and discussion. We are having some discussions around it. We're still developing that part of the strategy, and I'll leave it at that because it's still building up as we speak. All
right, we're working on some really simple augmentation tools to be able to do a couple of things. One is around dehydration, very, very critical for Australia's resource sector to be able to get early detection using wearables that have no batteries, but they're charged off the bioelectric charge of the skin. so that we're able to pick those up, and others that are looking for some of the early markers of cardiac conditions. So there's some really interesting elements out there, I think, that would fit beautifully in with the NEOM model, and
Yes.
I think it would be very exciting to see where you take it going forward. I'm just going to quickly go back to the questions, but I think we've covered out on everything: the cancer, the agreement of the nexus of food, nutrition, and healthcare, even the gateway cities and moving. So I think we've been able to pick up quite a few questions. And so, look, we're almost at the end, and I think what's going to be very exciting is how these systems grow, how we better connect, how we provide preventative health in an earlier sense, and how we move away from a very reactive model to a very proactive model.
Absolutely.
I have a question.
Yeah, Carmel, do you have a question?
Melbourne, Australia, so enjoying the lockdown, a fellow Australian. So,
Sorry.
just a question. It's fascinating what NEOM model is, and I was just thinking, because of what happened in Australia, in Melbourne in particular, with the new outbreak, etc. And how do you apply an integrated model like this to a very multicultural, diverse, large city, and where there were often problems around communication and servicing, etc., of different populations, as it were, or different cultural groups within the city? How do you apply a model? NEOM seems to be okay for a very homogeneous society, which is not the reality for many of the, especially big cities like Melbourne and Sydney.
So it's very interesting you asked this question. So NEOM, if you think of the population, it's sort of like Dubai. You have a mix of all nationalities, races, cultures. Everyone is there. And the hope is that we can become a benchmark for people to utilize different learnings from it to embed it in the current systems that exist. And it might not be the whole thing. It might be elements of it. For example, maybe in some systems, preventative care is not taken as instrumental as it should be, and maybe us showcasing that part of care to the world might have those systems use this learning to embed it more or focus it on it more. And others is just in terms of the integration of society, is that the sort of the focus is on health, and health unites people. If we have a group of nutritionists that come together with the doctor or the life coach and are able to manage your chronic condition in a way that it showcases in the years to come, we do a study and it showcases that 90% of the people or 95% of the people who are residents here had a reversal of diabetes or actually lived longer than they were supposed to, then that model will definitely be picked up. And that is the hope. And you're absolutely right. When you have a society where you have different, people and different cultures, how do you bring it together? It's really taking out what you understand, what you can actually implement from that learning into your own system. And our universal language here will be English. And it's a universal language. So people are generally thinking it will be Arabic. Arabic will be a secondary language, but English will be the universal language that will be used at NEOM. And it's the hope is to build a system that can serve as a benchmark for other systems to adapt to or take learnings from to cater to the current systems that exist. What we have is that we don't have a legacy system at place. We're literally building something from scratch. So it's a very different angle of learning and understanding and building is when you have a clean slate. So you look at other systems and take the best from those systems and then embed it into your own system.
I think, Carmel, it would be fascinating. Every city, though, is always growing and changing. And so maybe the model might be to look at what NEOM has done, and if there's a new development, a new suburb development, a new growth development, maybe start with that as a location. And maybe it's not everything, but it is. You could certainly design, through current design, the suburb as a gym, the healthcare centres, the engagement, and you could start in that area and then grow it out. But I think it's a fascinating question. Dr. Hashmi, I think we've reached our time.
Yeah.
I think we've
This was a very interesting conversation, and I just like the format a lot. And I want to thank actually specifically the organizers for bringing us here in this platform. And this is such a great way of learning, to say the least. And I just want to thank everyone for this opportunity. Thank you so much. And thank you. It was lovely talking to you as well.
Well, and to you as well. Fascinating. I think we're all would love the opportunity to come and see NEOM as it grows and develops. It'll be an amazing, I think, a real exemplar for what could happen elsewhere in the world. I think Carmel's point's very valid about how we could retrofit a city with what NEOM learns. And I think the acceleration of acceptance of telehealth and technology due to COVID has changed the landscape forever. So look, to everybody who's joined us, thank you so much for your time today. Thanks for your support. And we look forward to future sessions. Dr. Hashmi, thank you very much.
Thank you. Thank you so much. Thank you.